Okay, we will call the meeting to order. If we could have a roll call, please, Jessica.
Yes, Trustee Robinson,
Here.
Trustee Giroux, Trustee St. Germain,
Here.
Trustee Erbst,
Here.
and Trustee Pomponio.
Here.
We could all stand for the flag salute in the back of the room, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next is approval of the agenda.
Make a motion, we approve the agenda.
I'll second.
It's been moved and seconded to approve the agenda. Any changes or addendums?
Yes, the yellow at the bottom, the highlighted, the pet closure, those first 2 days, I forgot to add on there, but I added those today. That was the only addition. And can you guys hear okay back there? Is that better? Okay, perfect.
Okay. All in favor?
Aye.
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 Opposed? Motion carries. Next is our public input, which we do have a couple requests tonight. The first is Dr. McGrath. If you wouldn't mind coming up and sitting in the chair, turning on the microphone so that the people on Zoom can also hear you. Oh, we do it in order of submission.
All right.
So let me get my timer started here, just a minute. And then just to address the board for a moment. So Dr. McGrath and the next speaker have requested to send documentation and per policy that has been made available to you through your emails. And then they will do their 3-minute talk, but then if the board does have questions for them about anything that they spoke about, since they're considered experts in the field that they're presenting, I will open it up if anybody has any questions to ask for additional time. Okay. All right, Dr. McGrath, and hang on.
Yeah, thanks.
My
I
time keeps
appreciate the
going.
opportunity to address the board and just really to update some things that you're aware of and some things maybe you're less aware of. As you know, school started since the last board meeting without implementation of universal masking. And unfortunately, that's resulted in a lot of closures and students out of school and missed opportunities for in-person learning. This has only widened the burden of educational gap that these students are now going to have to deal with. You know, nationally, we also passed the 20th year mark of 9/11, and that was an event that I think we all agree was horrific and terrible beyond description, with the loss of almost 3,000 lives that morning. We now are losing that more than that many lives every 48 hours to COVID nationally. Regionally, we were stressed at my last report, but have now the entire state has been moved to crisis standard of care, which means that we're in, you know, that's basically a marker that we've come to resource constraints so much that we're having to make decisions around what cases get what care. It's a moment I never thought I would see in my career, but here we are. That's really what that means to us locally, is just that our already stressed system has been stretched further, and that it's extremely difficult to transfer patients for critical care services. They're not available locally. I have a list. This is a list of 48 hospitals that we use now to call. Several times we've had people with critical life-threatening events in the emergency department. We've had to call all 48 hospitals and not been able to transfer those patients. The situation really is that dire, and I just don't want anyone to mistake this as something else. I mean, I've been a physician in this community now for almost 3 decades and have put the bulk of my professional life into improving the health and prosperity of this community. And I've always believed that if we had a critical moment where the healthcare system needed the assistance of the community, we could always count on that. And I hope that we're at that point. But we really are at that crux right now where we need the help, and that help is the community as a whole, but also Joint School District 171. Infections in the school drive a lot of what happens in the community. You know, I guess I also just personally as an American worry about the lesson that we're teaching a different kind of educational gap. And that's when we have something that could, okay, I was just gonna say when, you know, a minor inconvenience such as masking could have an impact on the overall good, that we don't do that.
Okay.
That's an important lesson.
Does the board
I
have
do
any
have a
questions?
question.
Mhm.
Yeah. Can you explain to me, Kelly, and tons of respect for all of you in the medical profession. It's got to be gut wrenching right now. But can you explain to me how we could separate activity and behaviors in our facilities compared to what's happening in the community, and how we're not public health experts, how we can relate. You know, I've got the data that is provided and it's great, you know. But how is it that the school is a target and we're not getting more information for the general populace about, you know, the alternatives, masking, vaccination. There's not a lot of push going on there. So I'm really struggling with this, right?
Okay, yeah, sure. I
Yeah.
understand the question, as I understand it, is there's a piece with the school, but how about the rest of the community? Did I get that?
Yeah. I mean,
Okay.
I'm just.
Yeah, well, and there has been a lot of push. Maybe, you know, it's not been the right kind. We've, since the pandemic began, our providers have submitted articles in the newspaper every single week. I think we're at something like 80 weeks or something, consecutive weeks. We've been on the radio. We talk to patients one-on-one. We have conversations in the emergency department. But ultimately, people are going to do what they do. I mean, that's part of being a doctor, right? People don't do what we tell them all the time. And the schools are one of those areas where the students come to school, there's an opportunity, they are socially mobile and in close quarters, and that's a great opportunity for exchange of infection. We see it every fall, I mean, prior to coronavirus, and then it goes home, and then grandmothers, mothers, fathers, siblings get sick, and then it just spreads out. It's not that that's the one driver, that's one of many. But I think we have overlap of goals. I mean, when I read the mission statement of Joint School District 171, I'm reminded that, you know, you want to have a safe and effective learning environment. And I know that I think everybody agrees that in-person learning is best. So that should be a driver in itself to keep kids in school. And that overlaps with our need to change and, you know, what was the bend the curve, flatten the curve? That was what we heard about in the beginning of the pandemic, but that's what we need. And this is one step where the mission statement and the needs in the school to support in-person learning overlaps really very nicely with our need to tamp down community transmission. It's not gonna, that alone isn't gonna just do it, but it's one piece that's pretty pivotal, if that makes sense. Did I answer the question?
I'm just, if it is pivotal because the youth are together in a space for long periods of time
Yeah.
in a day. Is that the pivotal component?
Yeah, exactly. And certainly you know, a lot of the kids are not known for their best, you know, viral hygiene or whatever. I mean, we know that about, you know, kids. It gets a little bit better as they get older, but the older kids also are a little bit more socially mobile. You can't control what they do outside of school, but that is that time where they're in a low ventilation space. And, you know, I think it would be really, you know, I don't know all the geometry of the classrooms, but, you know, sitting with 20 or 30 kids in proximity, it has to be a challenge in terms of air exchange.
Yeah, my understanding is we don't have the capacity to adequately distance.
Yeah,
Right.
I mean, that makes sense. I don't know how you do it. I know that there's been some attempts, some creative things, but it's just a really hard problem that the school district is facing. I have sympathy. I mean, we've at the hospital put these high-powered fans that do 60 air exchanges, you know, in an hour, but you know, that took a lot. We don't have as many spaces as the school district has to manage. It's really a challenge.
Yeah, I mean, I give lots of respect to this issue, right? I mean, it's real. But I'm also overwhelmed by the community is almost half and half. The emails that I get, the information, the conversations that I have, although I've been pretty aggressively captured in grocery stores and post office and in corners, but you know, really, we're really split here. And
So Chris, we're going to have you hold that just for our
Yeah,
discussion
okay.
because we're going to be revisiting this, but we're still in public comment. So were there any more questions for Dr. McGrath?
I had one.
Okay, Angie?
Hi. Hey, Dr. McGrath, with the portion of our population that are in the schools between staff and students, the increased transmittability and infectious nature of the Delta variant, the increased effect on children who can't be vaccinated under 12 years old at this time, and the increased severity of the Delta variant, are you comfortable telling us, no matter how our community is split, that in our community right now, if we continue to go without masks in our schools, that will directly lead to hospitalizations, disability, and deaths?
It is a key driver, and I think you.
Actually,
think you
sir, you
touched
can't
on,
speak from the back. I'm
I
sorry.
think you touched on the issue of low vaccination, and you know, just because they can't be vaccinated, so that's one place. You know, it is a driver. You know, it's one of there's a lot of drivers, unfortunately.
There are, but if we were to mask this, you know, 1,100 people we have in our schools, do you think that would cut down on how many hospitalizations we have and deaths in the community?
1,100 people in a county of about 8,000. I would have to suspect just from the proportions that would have an impact.
Perfect. Thank you.
Okay. If there's not any further questions, we'll go ahead and move on to our next speaker. And just a reminder to everybody who is a bystander at this meeting, you cannot speak out or we will have to ask you to leave. Okay. Thank you. So Lenny Bonner is our next speaker. Timer. Go ahead.
Lenny Bonner, the CEO for Clearwater Valley Hospital, or Clearwater Valley Health, excuse me. I submitted some graphs ahead of time for you guys, and I thought it would just be good to kind of verbalize those and summarize them a little bit. But first, wanted to let you know that we have been doing a tremendous amount of testing the last couple of weeks. During the week of August 29th to September 4th, there were 249 tests, 79 of those positive. And during the week of September 5th through 11th, we had 263 tests done, 78 were positive. These are some of the highest positivity rates in the state of Idaho. Currently, the positivity rate across Idaho is between 20 and 25%, and we are at 32%. That first graph that I sent you guys ahead of time was our number of COVID positive inpatients, which shows that we have jumped significantly in August and so far into September. In fact, the last 6 weeks have made up 75% of our total COVID positive inpatients, which tells you the severity of the Delta variant. Only 2 of those have been vaccinated inpatients, which means only 4% of our hospitalized inpatients have been vaccinated. The rest are unvaccinated. As Dr. McGrath said, the entire state is in crisis standard of care. And that's for many reasons, but the main one that affects our communities is the inability for us to transfer patients right now, which means we're forced to care for some very critically ICU type patients in our rural hospital, which we are not normally doing. That's the standard that we are in the crisis for. That inability to transfer also slows down the care that we need to give for traumas, heart attacks, strokes, motor vehicle accidents, not just COVID. The next graph is the community transmission versus the average students absent. And what this shows is that last November, which was when we were at our peak community transmission, our absentee rate was actually less than half of what it is now, which shows that the difference of masking versus not masking now has made a big difference. That third graph is our vaccination rate for 12 to 18-year-olds. We don't have public health data specific to our county, but I do know what we have vaccinated, and we're at 98 kids between the ages of 12 and 18. So 98 in a district of 1,100 is a very low vaccination rate. And that final graph is our COVID testing and positivity for children. In August, we tested 91 students and 20 were positive. September so far, 15 days in, when I ran these numbers, we had 134 kids test and 35 were positive, which is a 26% positivity rate in our students. Dr. McGrath shared an article with you guys ahead of time why masking is effective, and now I've shared some data with you that also shows the effectiveness of keeping kids in school by masking. As the CEO of our extremely resource-constrained hospital, I can't express enough the importance of keeping kids in school. We need our employees to be able to work, and having kids at home hinders that. We need our children to be in school to adequately learn. We also need to keep our kids healthy. We don't have the capacity to care for them or their loved ones they're risking exposing.
Thank you. Are there any questions for Lenny Bonner?
No question, but I appreciate the data.
I had a question.
Okay, Angie.
Yep, I just wanted to have you reiterate, Lenny, that regardless of, your COVID vaccine status, our lack of masking in the district is directly leading to our hospital system's inability to treat people that are having car accidents, heart attacks, and other health emergencies.
Absolutely. That all leads into the community transmission. So maybe our kids aren't the ones that need to be hospitalized yet, but who they are exposed out on the weekends is definitely going to lead to our inability to be able to care for those patients as we would like to, or be able to get them transferred out.
Great. Thank you so much.
I do have a question. So is there any way to conjecture or project the percentage of infection that's happening in a school environment versus outside when they're running wild and free?
No, I mean, we'd have to do tracing with or public health, which they've not been doing as much as they used to, or at least we don't get that data. So, I mean, it would have to be candid interview process with those that are testing positive. And last time I checked with public health, they said they weren't even getting that much information back from people. So no, at this time, we aren't able to figure out where they're getting it and when and where they're exposing.
All right, thank you very much. That is the end of our guest speakers for tonight. Moving on our agenda. Is the consent agenda.
I'll move that we approve the consent agenda.
I'll second that.
It's been moved and seconded to approve the consent agenda. Any discussion or questions? All in favor?
Aye.
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 Aye, but I think I hit mute in the middle of it. Sorry.
It's okay. Opposed? All in favor, and motion passes. Sorry. Reports and recognitions. We did get a few featured team members actually documented from our building administrators in their building reports this month. So thank you for that, and giving a shout out for those hardworking employees that have been keeping our schools together and clean and all those things. Any questions for any of our building administrators or the reports? No. Okay, and moving on to program reports. I was going to ask a question about transportation. I noticed that our new bus still isn't in service. And I guess I didn't quite understand what kind of approval it has to pass before it can be used.
Right. So one of the things that came up on our transportation is we ended up with no seat belts on it. So that was missed out on the bid. So we are working to correct that. We're going to retro that, and then it has to go through a state inspection. So it was purchased from out of state. So we have to go through the state inspection with that as well. So there's some things that are a little bit different between state to state. So currently working on that. I've actually sent some of the information to our attorney, as the company is not wanting to stand behind a lot of those things, but I think we've got most of that lined out at this point. So hopefully it'll be in service soon.
How are we doing on hiring bus drivers? Any headway?
Same. Do you have your license yet?
No.
So we're to the point. I just had an email conversation with Derek this morning, and they're looking at canceling some activities or to transport because we just don't have enough drivers to do routes and activities when they leave before school's out. So anybody out there in the crowd, if you're interested in driving a bus, we'd love to have you. Got to get your certification.
You'd only want me to do it once.
It's pay to go see the game. How's that? Is that a sell?
Any questions? Did you have any summary you wanted to give for your superintendent report?
No, most of the work I've been doing is trying to balance our COVID issues. So we'll have that during discussion if that's okay.
Okay. Then we're just going to jump right into our discussions. Okay. Back to school plan, which is our COVID discussion.
Yeah, so I can start off with this, and we had some guest speakers that came, from the public, and I appreciate the professionals giving us their input. So a couple of things that I've done so we can have a little bit more data on this is number one, if you look at our policy, policy 3520 talks about us as you guys as a board and us as administration to take the advice of our medical professionals in times of crisis or in times of pandemics and infectious outbreaks. So I think we are, looking at that. I think we're talking to people. I think that's important. So that is an obligation of our board to do that. Just as it would be with any other, whether we have an outbreak. And one of the things I really want to bring up is we're dealing with numbers, not with cases. So one of the things we look at as a school district, one of the things that we have to continue to weigh is how many kids are in school. If they're not in school, they're not learning. So the only thing we can do is track. So I guess kind of give a little bit backstory on this. And this is, we do it every day, so it becomes a little bit more simple for us. And I don't want to make it more complicated than it is. So basically our kids, if they're out either as a positive, a confirmed positive, or if they are quarantined, which means a direct exposure, they're out of school. And those are all determined on different amounts of time, depending on what public health recommends for each one of those cases. Bottom line for us is the kids are not in school, they're not in school, whether they're sick or whether they're quarantined. And that's our issue. That's our concern as a school district is if we don't have kids in the classroom, they're not learning. And that is just not what we're here for. So that's a big concern. So as we go through the options of things that we can do, we've talked about lots of different opportunities to manage what we're doing with kids. So right now, we literally have one person in every building, at least one person, who is full-time tracking our kids who are quarantined or sick. And it's a big job. It takes all day, every day for at least one person. I know that sounds like it should be more simple than it is, but when you have a bunch of kids going and coming, depending on where they were exposed, how long they're out, what their positives are, if they're sick or they're not, bottom line is they're still out of school. So it's really difficult for us to track that. It takes a lot of time, a lot of effort. So we looked at different things. The way our protocol is set up, it's set up to say, if you're exposed to somebody directly and you're masked, you're not going to go home. You're going to stay in school. So our protocol directly reflects the ability for us or the inability for us to mask. So the reason we're seeing so many kids home is not necessarily positive COVID cases, it is quarantines. So it's a direct reflection of those positive cases, but it's still the quarantines. So we had, and I'll just use Orofino Elementary School last week before we closed it last week, we had approximately 145 kids out of how many total kids do we have, Denise? 360? So 145 kids out of school out of 360. It's a pretty big percentage. Those kids, of all the ones that are out, we had roughly 95 that we knew were sick of some sort. And of those 95, we knew there were, what did we decide? What did we finally find out? That we knew there were positives. 30, 32 or 3, if I remember right. So you can see the direct reflection of the amount of positives we have versus quarantines. If we just had the positive kids or the sick kids that are home and our students were masked, so they were not worried about being exposed, then we'd have all those kids in school. So one of the things I did also was I took our options and actually presented it to our staff through a survey, and I shared that survey with you guys. It's still open at this point in time. There were 68 responses that we had. The options were as follows, and these were both open-ended questions. There was no leading, there was no anything. Basically, it just says, would you support masking throughout our buildings and buses, similar to what we did last year, yes or no? And then you could make a comment. So out of the 68 responses, there was actually 68 responses at this point. 36 out of the 68 said yes. So 52%, a little over 52% said yes, they would support that to keep kids in school. Most of the comments talked about, and those are definitely comments from all directions. They said, yeah, we want to keep kids in school. We want to make sure that we're learning. The masks are an inconvenience. Yes, absolutely. It's torture, but having kids out of school is worse. And that was really the gist of that. The second alternative was basically doing kind of like what we're doing, only trying to get kids back in school. So there were some options of, okay, if somebody's quarantined, can they come back with a mask for 2 weeks? But tracking that again is a nightmare. We've lived it for almost 2 years now, not quite 2 years. Tracking this as educators is difficult. So we're trying to simplify this as much as we can because our primary goal is education. Obviously, we have an obligation to public safety. We want to keep kids safe. We want to keep our adults safe. But number one, we want to keep kids in school. So when the results of that was, will you support this plan? And overwhelmingly, 58% of the respondents said no. Too complicated. Who's going to track that? Who's going to keep track of it? Who's going to enforce it? How's this going to look? So to me, that sends a pretty big message from our 200 employees. We only ended up with 68 responses, but the people who responded, they made comments and, they were from one extreme to the other, and that's what we'd expect. And it was completely anonymous. So I have no idea who said what, but the data was from our district is basically saying, let's get back to business in education. And if we have to put on a mask to do it, what's the problem? So that was a piece of it. Also summarizing, and we've already talked about this a little bit, we summarized every day with our positive cases versus quarantines. And we're seeing pretty much, when you look at the smaller classes or the classes that are contained, such as Orofino Elementary School, elementary in general, when you have one student in that class that is positive, the way our protocol is, we quarantine the entire class. Therefore, you end up with one possible positive or one positive and possibly 15 to 20 to 25 kids out that are quarantined, that are exposed. In high school, it's a little bit different story. You have one kid that is roaming the halls and is in with other kids in different classes. You've now exposed basically everyone. So we had that incident happen basically at Timberline, or even a staff member, either way, that sees, a couple of hundred kids a day or 150 kids, you've now exposed 150 kids. So for us to manage that, it's very difficult. The simple factor on our protocol and what public health advises and What we've been lived by from the beginning is if we're masking, the kids are still in school. And is it a pain? We've all said that. Yep, it is. Ask teachers. Yep, it is a pain. But the kids are in school, and that's what's important. So going through data set after data set after data set, I can show you graphs that we've done this year. What we've seen is the numbers continue to rise. When we close school, they drop off. We're not in close contact. We come back, they're starting to show. Even today, we dropped off in at Orofino Elementary School. We'll probably, likely see a rise tomorrow and the next day, but that's pretty typical. The graphs that Ms. Bonner sent to us and shared with the board had some really cool information. I'd like to share that if you would allow us to share that with the public as well. And I can put that up here on the board so everybody can see if we want to do that while you guys are discussing. Supports what we're saying. 1,100 people, when you've got a couple hundred staff members, my concerns are very simple. We have very few subs. Bus drivers, we have very few subs. We're just running by the skin of our teeth right now. We're seeing kid after kid after kid get quarantined and out of school. So, it's something we need to really think about is, what are our goals? And when I look at our goals, I think our number one goal is to educate kids and keep kids face to face. We've tried it the other way. The community, the teachers, everybody has already stated that is not nearly as effective as doing it face to face. And the only way we can do that is to do the right thing. So questions for me? I know that was a pretty long spiel, but it's been nothing but data today, I can tell you, and COVID data.
So I will open it up to the board for further discussion.
So I noticed on the staff survey, there were quite a few that said no to both options. So
Yep.
where does that enter into the number on it?
So it just is, so each one of those questions was yes or no.
Uh-huh.
So you could answer yes or no for each one. You didn't have to pick one or the other.
Oh, okay.
Some people said, I don't like either option. And then other people said, oh, I like both options, either option. So that just gave them the open opportunity to not have to choose.
Gotcha.
I just think it's really clear cut that we have policy saying we need to follow medical professionals in situations like this. Our medical professionals are saying there's a direct line between not masking in the schools and death and illness in the community, and the inability of our medical establishment in the community to take care of any kind of emergency, whether it's COVID or somebody getting in a car wreck on their way to work or having a heart attack. And our mission statement is the first line is a safe environment for our kids. It's not, it's not pleasing the constituency. It's keeping children safe. And we all agreed that our mission was going to be to keep kids in the classroom, and we're failing at that. So we need to do a root cause analysis of where the problem is and fix it. If we put our kids in masks, they're going to stay in the classroom. We're going to save people's lives in the community, whether or not it's about COVID or a car accident. We're going to help reverse the collapse of our medical establishment for the state. We'll maintain our mission of keeping kids safe and help our community. I just don't see popular or unpopular. I can't really see why the controversy is when we know that people are dying of this in our community. The only way to keep our schools open, kids in their seats, and help our community have less deaths is to have us wear masks. That's it. It's basic to me.
So I put up on the screen what Lenny Bonner shared with us. So there's some pretty interesting information on there that shows some trends. And the one that really probably stands out more than anything is if you look at, well, all of them do. It's hard for me to see that on here. Can you guys see that? Yeah. Yeah, not really. Not on this one. Yeah, maybe if I can put this off to the side. Yeah, I've got it. It's covered up here. Sorry. There you go. So if you look at this upper right, and I don't have all of, if you can see that very well, sorry about that. So you can see the community transmission per 100,000 lives, and then you can see our average absences. And you look back at November of 20, you can see we had a pretty significant amount of absences. They dropped off through the spring. You can see the cases that drop off here. Whenever you're looking at the actual community transmission cases versus the ratio of our students out, you can see it's pretty close. There's that one stands out to me about as much as anything. When you look back here, you see a big difference in the lines. So that one, Lenny, thank you for that information. We kind of collaborated a little bit on that as far as our absenteeism and stuff. So, and one thing keep in mind is we don't have an accurate number of COVID cases. What we have accurate number is kids out. We have what our constituents tell us that are positive, or the kids we know that are quarantined. But for example, if you have, a third grade class that goes home with one positive, we don't know how many more of those kids are positive or not. We just know that the rest of that class is quarantined. So our data is only kids that are really out. I mean, that's really what we have to work off of. Is we're not the healthcare people. We are attendance and education. So if they're not there, they're not there. So.
And one thing someone pointed out to me today too, is the fact that we are telling people to keep their kids home if they're sick.
Yes. So our attendance is down. Yeah, absolutely.
So
and we
they could
want people to
have-
keep their kids home if they're sick. Yes.
Yeah, I mean, they could have
No matter what it is.
a cold, a flu, a ingrown toenail, who knows?
Well, and that should be the same no matter whether we're dealing with COVID or anything else. So, yeah.
We had talked about a classroom scenario where if a child was in a classroom and got sick, or human in a classroom got sick, then that sick individual will go home, and the rest of the humans in that class would mask for the recommended 14 days. It kept kids in school. It dealt with the public health aspect that we are being forced to play our hand, and as educators and as educational institution, then because and I went through a association book and made notes for myself on what our role is, to help me think through this, and is that we have to, if they're going home, we need to provide them with an opportunity to continue learning. So if the board,
Chris, we can't hear you.
if the board so chooses a direction that some of our population chooses to go home, to not come to the institution because of requirements that we set on them, what are we going to do to allow them education?
So is that a question?
Yeah.
Okay. So we attempted this a couple years ago when we went out, and doing online we know was very ineffective, and there was multiple reasons. The engagement was minimal compared to what we would have in school. The learning process, our teachers are very talented and capable of doing both, but it's a strain. If you have some in school and some out of school, it's like teaching two classrooms at the same time. Very difficult to do. The effectiveness is, I could probably get administrators involved with this, but we've had lots of discussions over that, and it's tough. It's tough to get the kids to engage. We have not only just engagement issues, but we also have geographic issues and limitation issues on devices and connectivity and those type of things. So that becomes a challenge in its own. So there's a multitude of challenges. If we wanted to do online school, we should probably be doing online school. We're set up to do face-to-face. And yes, we can temporarily do that, but it is a challenge.
But the inverse of that is that we lost students because we're not masking. So we lost a number of students last year and then this year that are medically fragile, have medically fragile or high risk family members that are not coming to school in person and not doing online. So we have families on both sides of this that would have students stay home. So we are offering an education to everybody, but our mission says it will be a safe environment. I don't, it doesn't speak to popularity, it speaks to safety. And it's like the data is beyond clear what is safe. And going without masks now is not safe. That's not offering a safe environment. It's not safe for our employees. It's not safe for our students or their families or the community as a whole.
You know, and one thing that really bothers me about this whole thing, I mean, it just chaps my hide, is the fact that we have kids in school and they're not masked right now. And we have all the activities within the community, everywhere. We've had probably 5 or 6 weddings in the past month and a half in this community where there's 100, 200 plus people at each one of them. And they have not been super spreader events. So there's a lot to it. And I'm kind of the mind of go big or go home. I mean, if we're going to mask, then we better mask right. And it better, and all that entails, including social distancing at lunch, making sure that the kids are wearing their mask effectively, making sure that the teachers are enforcing the mask. And you get right down to it. We be having sports? Should we be having a lot of this stuff? So it's kind of a go big or go home kind of a thing. And the high school, it has been fine, I understand. Correct? So I don't know. I have lost sleep over this for the past week. I will guarantee you that. Because I listen wholeheartedly to people and what they're telling me and what I'm seeing. And I read the statistics and I educate myself and I do all that. And I'm still torn.
I'm just going to make a couple comments just because I think it's important to remember what happened last year and what we've lived through already in the 18 months of this pandemic. March of 2020, we heard word of this pandemic. It hit the United States. Everybody was so scared. Nobody wanted to come to school. Nobody wanted to come teach. And we closed the schools down, even though we didn't have any cases in our community. Last fall, the kids come back to school, 2020, and our numbers start to rapidly increase. We could not keep the high school open. 2-3 different times we had to close it because there were so many cases between staff and then later between students that we could not keep that school open. And then we made the mask mandate decided upon by the board, and we were able to keep the schools open for the entire rest of the school year. That is learning from experience and learning from example. And we can't necessarily look to our community for the example to live by, as hard as that is, because our community has made a decision as a majority not to get vaccinated and not to take precautions for COVID. And that is the community that we live in. But that doesn't necessarily dictate what we decide for our school and for our students.
So my question is, do we have a responsibility for those that choose, if a mask mandate is the direction that this board goes, do we have a responsibility to provide an educational outlet to those that are unable to mask from whatever reason?
We have not made that decision to provide that education for the students who were not willing to come to school in an environment where they were not masked. So therefore, we would not make that same allowance for students who are not willing to come to school in a masked environment. So we had many students unenroll last year because we did not start school and promised to have that safe masked environment despite the recommendations by the CDC and public health. And so we had students unenroll and they did not get additional services from our school district.
These are currently enrolled students.
Mhm.
So we don't have an obligation to provide an educational option for them.
We did not last year. They were in masks from mid-September, October, all the way until March last year.
And so the board is not willing to discuss providing them an educational option?
Sorry, we have discussed it. This was back in the spring of 2020 and the summer of 2020, when we were trying to prepare for what was going to happen for the last calendar school year. It was hours and hours between administrators, school board members that were on the board at the time of trying to make every available option possible. And it came down to the lack of resources, the lack of internet access, the lack of staffing to be able to do both simultaneously.
Well,
So
and
have
yeah,
we,
I was gonna say, I think it came down to a lot of it was we have to do it equitably, and we can't do that because we're across the board, we don't have equitable internet access for families in the community. So that's not something that we felt we can fix. And the other thing is we lack the staff to manage it. We don't have enough teaching staff to basically have to operate double duty in classroom and online teaching. And so, I mean, we weren't able to provide that for students that left in-person schooling because there wasn't masking. So it seems disingenuous to offer it now to students whose parents don't want them to mask.
so how do we provide education to those that have an accident and are unable to come to school for a period of time?
So public education, there's actually a difference between choice and requirements. As they are required to, and Angie hit that on the head, equal education to all. But if they choose not to accept it, then that's their choice. And that's state law, basically. Parents have the right to choose that.
And a child with a disability, that would fall under disability, not choice of
And
environment.
Mr. Lee, would you,
And
yeah, absolutely. Yeah.
And we have, I mean, parents have the options of IDLA, Connections Academy. There are online schooling options if they freely and willingly choose to opt out of our public school.
So right now, when students are on quarantine, which at our school hasn't been due to exposure at our school from, we know, we've only had one positive COVID case and it had nothing to do with exposure at our school and it was contact trace. But if they are on quarantine, they have the option of Zooming into the classroom. If they don't have the internet access, then we provide them resources through different packet type work to be picked up at the office. That's same with if we've had students who are medically fragile and couldn't attend school due to increased COVID risk, both with masks and without. It's the same. The parents I never had a parent say I wouldn't send my medically fragile student because you're unmasked. It was because the high COVID risk rate at the time. It didn't have to come down to masking. What it came down to was the fragility of the student. And they didn't think that masking was going to be preventative of that. It was just exposure to the school. We do provide them with resources, especially if they're medically fragile under the 504 law. And so if you look under 504 law, if the student has a disability and can't attend school for whatever reason, and COVID was titled as one of those, if they're medically fragile, then we provide those resources. In certain cases, we've provided additional paraprofessional support for that individual, depending on the situation. And so under 504 law, also within that is the IEP law, which you can individualized education plan. And so we've had to modify and adjust those education plans based, and that's with or without COVID. We do that all the time for kids who are medically fragile or have a extenuating circumstance where they can't attend. Right now, if students are out, it's not as good as being in person, but we do our best to either Zoom them into the classroom, provide them with resources. All of our teachers have Google Classroom set up, and we provide them with the work and the support necessary to hopefully they don't fall behind. We also allow some grace for those students because we don't want to penalize them for something that's not within their control at that time, but we want to allow them to access as much learning as possible.
Thank you. That's very helpful. So we do have the capacity to deliver education to those that choose to not come to school based on a decision we make.
I would say
it's a
not
mandate.
just student choice, because what you fall into if you just allow student choice based on one variable or another, then what you will encounter is a hit or miss scenario. A student might say, well, I'm not coming to school because I don't like math, or I'm not coming to school because I need math, or whatever it may be. Typically it would fall under the I don't like math category. But then a few days into it, they realize, well, I kind of want to be at school. So then they come back, and then they say, well, I kind of don't want to go to school today, especially with the older kids. I'd say younger kids, that's probably less of an issue because there's more parental control. But with older students, it really creates a roller coaster of kids in, out, and just kind of depending on personal preference of whether or not they wanted to go to school that day. So you encounter a whole nother scenario, a whole lot more. And so you don't, it would not be a good system. It would be very difficult to provide equitable education if you're just allowing kids to elect to come to school or not, based on that scenario.
So my understanding is that part of our thought process is also related to financial sustainability and the way that the state funds education. So if a student, Michael, if a student doesn't come to school because of a mandate requirement, and if they have a justifiable health reason or for that, is there a mechanism that we are still covered for the cost if we're delivering education to that student?
So a little bit more history on that, I guess. We are paid primarily through ADA, which is our average daily attendance. So that basically is the number of kids that are at school every single day versus how many are enrolled. So the percentage of kids that are there every day. So general absences count against our ADA. Last year with COVID and the state legislators changed that formula to where we were getting paid basically we were getting paid by enrollment. So we were getting X number of dollars per kid. It doesn't work quite that simple. There's a formula that feeds lots of different avenues, but the basic principle is when our enrollment, we were getting so many dollars per kid. This year that law ran out. So this year we're back to the ADA, which is our average daily attendance. So typically our school, if we're running around 92 to 95% attendance, we're doing okay. But if we have 20% of our kids out for any kind of extended period of time, that's hurting our ADA. That's hurting our dollars because it brings that percentage down. So we have to look at our our first 28 weeks or our best 8 weeks throughout the year. Right now, seeing kids out on quarantine and those type of things, last year we were forgiven for those basically. So if kids were on quarantine or positives, they were still enrolled. So we would still count them even if they were not in school. We could count them on our attendance on our books. This year, we're not able to do that as well. The state is not wanting to support that at this point. They may change that. There's talk of that since there's so many schools having difficulties right now. But really, it does make a difference in the money. So if you roughly we end up with about $10 million from the state. There's more federal money and things that come in as well. But with our state programs, somewhere around $10 million, really rough number. So if you're taking, 15% off of that, it hurts pretty fast. 1.5 million can drop out of our funding, short amount of time if our attendance drops 10 to 15%. So did that help? Yeah.
And do we have a mechanism to facilitate testing, COVID testing?
Do we have a mechanism in school? We are provided test kits. The vault test is what we have from the health department, public health. We have a surplus of them that we can hand out to. The public health has advised us to do that. We don't monitor or oversee. If somebody asks, we will definitely give them one. That is an actual lab reported test. It's a saliva test, basically, and you probably know more about it than I do, but basically it's a kit that you download an app. Somebody comes on and watches you basically spit in a little vial, whatever it is, and add the chemicals, whatever, and pack it up. So there's some efficacy there with that as well. And then it gets shipped off, and then I think it's a 2-day turnaround. So we do have those available that we'll distribute if somebody's interested to see. And public health says we can order more from the state. I believe they have a supply. I'm not sure where they stand this week. That's a week by week thing on whether they have them available, but we do have some available, yes.
And are we communicating that when we have like the quarantine at Timberline and here last week? Do we
Yeah,
let
so-
everyone know those are available?
So I let the administrators know that we have those available. Our school nurse as well knows that we have those available. We're transitioning between school nurses right now, so we're probably not communicating that as well. Yeah.
The one clarification I wanted to add about the remote learning or the learning for students who aren't in school, that actually the difference between last year and this year was that the problem was at Orofino Junior Senior High School last year, and they were actually ready to go to online learning immediately, and they didn't skip a beat. The kids took home computers. The next day they were back online with their teachers and in the classroom again. But I think that's the exception within the district because of the location of those students in Orofino, as well as the technology that they have. The elementary school, as well as Timberline, as we've seen in the last 2 weeks, don't have that same ability. With the younger students need more supervision and help to be able to navigate an online learning environment. They don't necessarily have the ability to use those Chromebooks on their own. And Timberline does not have the internet access to be able to do that successfully at this time for their students from home. So I
And-
just wanted
Yeah,
to,
and last week, just to clarify a little bit, we had some issues with, and I think Russell can speak to this on technology. We had some issues with our Chrome, Google Chrome connectivity, and it wasn't anything on our end. It ended up being something on the Chrome side. Is that correct, Russell? So we didn't have Chromebooks and technology in the hands and logins into the hands of our kids and getting them logged in until in Orofino Elementary until that Wednesday, I believe, before we had the issue, something like that. I think you said Wednesday evening. So the kids didn't have that technology in their hands, and to ask a young student to log in if they haven't practiced that is sometimes difficult. So, and I'm sure he can answer more to that if you wanted to know.
So, so in thinking about it, is there an opportunity for a school by school discussion? We've heard that the high school has no issue right now. Timberline had an issue, or Orofino Elementary had an issue. Can I ask a question of Dr. McGrath? Appropriate? Okay. So, Dr. McGrath, do we have any data that talks about recurrence? So I wrote the numbers down, 145 kids out of 360 out. And so they're dribbling back in, I would assume. What is there any data or information out there on a recurrence rate?
You mean, so people who have been infected with the coronavirus, like the recurrence rate?
Did we crest the peak of the wave and now we're on the way downhill and Orofino Elementary is done from the Delta virus perspective?
Yeah, I don't know locally, there certainly if people we're seeing people that were infected previously with a different variant are susceptible certainly to reinfection with the current variant, but we don't know that locally. I mean, it's really hard to tease that out, if that makes sense. And, it seems with the Alpha variant that there was about a 90-day protection, where about 90 days after infection with Alpha, the likelihood of reinfection was pretty low for about 90 days. And then it picked up, which makes sense with most infections, it'll wane. But with the Delta, that's a little less fleshed out in terms of that interval. I bet it will be, though, as we move along. I don't know. Did I answer the question? Maybe I got off in left field there.
No, that's okay. I'm
Yeah,
just trying
yeah.
to gather information and think
Yeah.
about, what's the right way to approach this. I don't want to be in a public health position,
Yeah, right. And also, I guess the other issue there is that of those chunk of kids out, at least what I understand, most of those kids aren't sick. So we
Correct.
can't, it's a smaller core that's actually sick that's pulling those other kids out with quarantine, but which may or may not be sick. I mean, it's always hard to also measure asymptomatic infection. That's the tricky thing there too. But
So is there a way to think about this instead of a institution-wide mandate about measure or managing outbreaks with reactive masking with, is that because of the
Yeah.
activity in the community, because
Yeah.
we have this lack of,
I think you'd always be chasing the genie that's out of the bottle in a way, if that makes sense. You know, I mean, to do it react. I mean, that's what they tried early in the pandemic. Remember, in sort of March of 2020, that was this whole idea of like, well, we can stop it. We're going to just, when it came to the United States, we're just going to go hard on these cases. And that was a much less infectious variant. And you saw the whole country, public health, going in on these few cases that showed up in Seattle, and it was, you know, a lot more resources than we have locally, and it didn't work. And that was a less infectious virus. So I don't know, that sounds like, first of all, a really hard job. And then I think it would be always chasing the genie that's out of the bottle. I mean, the virus has moved on because it'll be infectious a couple days for some individuals, a couple days before they have symptoms. So you're, you know, the trail, you're always a couple days behind the trail. It's hard. This is super hard. And I know this is, nobody in this room want, you know, this is what we aspire to. We'd rather be talking about education, or I'd be talking about other healthcare stuff, but here we are.
thank you.
Yeah.
Well, I think too, just keep in mind that we've got kids, you know, from multiple schools on buses. We've got kids from the same families and staff from families with students across multiple facilities. So that complicates that. And we also have a pretty like low rate of testing in the community. So we have a lot of people that won't get tested. So the numbers we have still are probably less accurate and, you know, trending lower than what they actually are. So we know with the numbers we have that we're already way higher than the state average and in a really bad situation with our healthcare here. So, and then to add to that, you know, we have a lower than average rate of people actually even getting tested or reporting symptoms or exposures. I just think we're in a really dangerous spot, and our healthcare community is telling us they are at the breaking point where they will not be able to care for people in this community, and we will have people die because we're not masking. We need to mask up. If we want things to go back to normal, this is how we get there.
Is there a threshold at which, if such a mandate was initiated, is there a threshold at which we say, okay, we can relax, we can go back to highly recommended? Is there data out there that says there's a threshold number?
I mean, the public health rates our region in green, yellow, or red. And I think an even more accurate representation for our community would be saying, let's mask until the chief medical officer for our local health system says that we're safe to go to recommended. I mean, they have numbers and you know, case-based data that's coming in every single day, and they're there to see it. So to me, if we're masking to save lives in our community, we should probably rely on our local healthcare experts that can say, okay, we've got a handle on this, and we can actually find beds for people, and we can treat people here. It's safe to relax a little bit. So that's what I would recommend. And, you know, Dr. McGrath is excellent at pulling data from multiple sources. So I know that he'd be in touch with public health and what they're doing and what's going on in the state, in the region, and specifically in our community.
One of the numbers that's used, not just by us locally, but is used internationally. And actually we use it in the hospital to trigger different levels of what we're doing. And it's the percent positivity rate is a good predictor. And the number of 6% tends to be the threshold. I mean, we were all feeling great in June because that number got back down around 6%. And at that level, pretty much the positives that you see in the community tends to reflect what's really there. where when that rate gets above that, you're just seeing the tip of the iceberg. So that would be one number that we'd really look to, would be seeing, like, if we, it's not zero, but I mean, zero would be beautiful, right? But 6% or less is probably that point that we've moved into a different and much better situation with the virus.
And how do we get that data?
Yeah, well, we track it as a health system, like I see it 3 times a week.
Okay, so it's
yeah,
readily available.
readily available. I see it all the time. Right now, we're at about, I think we're at the 7-day average is 20%, and we're still higher, 28% we were last week, but yeah, it's running right in there. And it really tends to, if you tracked it all the way through the pandemic, as we've done, it tends to be sort of a leading indicator of where we're going. Like when it started to come down, cases came down. That's when we relaxed some of our programs at the hospital, and relaxed our visitor policy, opened up some programs, started doing some elective procedures again. But we use that number. It's not the be all end all, but that's a pretty good, that might be a good at least reference. And if you're not seeing, I suppose if you had 6% and you're seeing an enormous number of cases, it just means people are getting tested a lot more. But I think that's unlikely that would be the case. You just would have to look at both things, how many cases we're seeing, percent positive, and that'd probably be a good measure that you've moved into a different zone. I mean, we're all hoping, I mean, who knows? But we're all hoping that this is a wave that's going to crest over us sometime this fall. There's various people that model these things, and they're sort of predicting mid-October is the peak. I don't know. I mean, that's just a thought, right? I'm not hanging my hat. I don't think any of us are hanging our hat on that. But people whose job is to model this are saying that it probably is going to roll over us at some point this fall, and things will hopefully start to go down.
Could I have that data, Lenny? Could I look at that trend? Awesome. Thank you.
Okay. Any further discussion about this item? Okay, we feel like we've had a chance to, I guess, let me reach out to the administrators. And did any of the administrators have anything else they wanted to add?
First of all, I highly appreciate our medical community and everything that they're doing right now. I can't imagine what you're going through, and having to hold someone's hand while they're suffocating slowly is something that I think most people in this room haven't had to experience. But what I can tell you as an administrator, and I speak for most educators, that we hold kids' hands every day while they suffocate from social emotional wellness, from psychological needs. And I can tell you that I know something as small as masking might not seem like something that's going to elicit these depressions in these kids, or their ability to read facial expression, or their ability to do these things that we value so much in our psyche. But I just want to make the point that it's not as cut and dry as it may sound. We have a lot of kids that suffer from depressions, anxieties, that something like masking has elicited. We've seen them sometimes slowly suffocate under what they might feel is an oppressive atmosphere. And so I would hope maybe our medical professionals could give us some insight on the value of being able to see someone's expression, being able to not hide. Sometimes when kids walk into the building, when kids are in the hallway, what we do as educators is we look at their faces, because we see whether or not they're struggling with something. We see whether or not there's something going on that allows them to be healthy that day. And that psychological health is not exclusive to personal physical health, that they work together. And I just think that's an important point. And I understand that we're operating under a set of rules set by the public health that says, if you're exposed for this period of time around someone that's not masked, you have to be quarantined. Not everybody has followed that. We have in our building, and we have as a district, and we've been consistent on that, but not every district has. And so I'd say also before decisions are made, I would look at the data in the districts who have not followed exactly what we've done, and let's learn from what's happened. Let's learn from the impact that it's had on our students and our children, because it's important. That social emotional piece is, I don't want that to be overlooked. I absolutely value and understand the health aspect. I also think we should have that a conversation should take place about the physical well-being as well as emotional well-being, and that has shown to have a greater resistance to anything, whether that's COVID, the flu, colds, anything like that, we spend a lot of time talking about reactive strategies. Well, let's look at some proactive strategies to help our youth become healthier, and so that they are more resilient to these things in the future. I also would wonder, I guess a wonder of mine would be, in a school environment where social distancing is impossible, where kids are interacting masked or unmasked, are we just taking this off of what the public health department is saying, or are we taking it off of our experience of what we see kids do? Is it really mitigating the spread of the virus, or is it because we're playing the rubric that's set out to us? Is the masking in school? I'm not talking in general. I'm not arguing. I'm not politicizing this at all. I'm very centric on it because that's not my job to politicize it. But I think they're worthwhile questions to ask. And I think that's what many of our community members want to ask too, and engage in good dialogue about it, to where it doesn't become a push-pull relationship, to where there is positive dialogue, where voices are being heard, and it's not just a one side versus the other side. It's, do we feel like masking in school truly reduces the amount of spread in a school environment, or with the interaction that these kids are having, is it more just an opportunity for us to say, instead of quarantining a large group of kids, we're only sending one kid? So are we doing it because we're playing the game, or are we doing it because we genuinely feel that in a school environment, it does mitigate the spread of the COVID variant? It's a question. I think that dialogue is important to have before we make decisions.
Thank you.
I think that that's probably something that Dr. McGrath could speak to, but data from around the world is completely clear that masking does slow the spread. And no matter how healthy socially, emotionally, or physically you are, masking, vaccinating, and social distancing are actually the best ways to fend off COVID, not just having a robust physical or emotional health. So I think that we need to make sure that we avoid things like how we feel about data, because data is data. So that's really proven science, and it's not about feelings. Masking works, vaccinating and masking work, and those are your best defenses. And I think if you wanted to have Dr. McGrath respond to that, it would be sensible, but that's misinformation, and that's not factual. Science is happening whether we agree with it or not. And the science is that masking, vaccinating, and social distancing work.
I was actually just going to reach out to Denise, since she is here tonight. Did she have anything she wanted to address to the board?
So I don't have a lot extra to add. I know that this is a difficult subject, and I agree that this isn't a place that any of us want to be right now. But I would like to say, I completely agree with Brian about the social emotional aspect. Getting our kids back to school last year, even though they were masked, was very important. And that's kind of where I stand on this. Whatever it takes to keep our kids in school, I think is what we need to do. As far as their ability to learn with masks on, our data shows that our kids made larger growth in foundational skills last year than they have in the last 5. And they were masked all year last year. So whatever the decision is, we're going to make the best of it. But I hope that the decision is to keep our kids in school at all cost. So that's the input that I have.
Thank you.
So I attended a superintendent's meeting of our region last week. We talked to every school in our region, and this week, and looking at their protocol versus ours. So there were several schools that are not masking. There's several schools that are not even quarantining. Those schools are currently closed this week with very high infection rates, not quarantine rates, but high enough infection rates in their school that they close. We've closed because of quarantines. So there's a difference. So without the masking, without the mitigation, the schools have failed. So, you know, we're seeing it. It's not just us. It's an issue that's nationwide. It's everybody discusses it. It's a challenging time for everyone. There's no doubt about it. I can tell you, you know, my staff, you know, from leadership all the way to wherever, they're struggling because it's just tough whenever we don't have kids in school. It's difficult whenever we have teachers going out on quarantine or positive. It's difficult just all around. If the kids aren't in school, and to speak into the social emotional side of things, you know, there's been a lot said here, and I respect and everybody that spoke. It's important to have the kids in school, whatever that means is. And yes, would it be desirable to have them without masks? Absolutely, that'd be awesome. But the fact is, we've been closing schools. We've been seeing 25% and more of our kids out. So the bottom line is we need to change something, whatever that is. We need to change something because we're struggling to keep kids in school and we're not doing what we're supposed to be doing.
So I'd like to propose that we change the policy from last year that disallows us to offer a learning opportunity to those that choose to oppose a potential mandate as step one.
So it
And
wasn't.
I
the
know it's not
poli-
an action place
Yeah,
here,
that would be action,
It's
but,
for discussion and reaction.
right. And so again, we'd gone through this quite a bit in the spring and summer of 2020. And we had actually had that implemented initially in like July of 2020 for our back to school plan. But realistically, we weren't able to provide an equitable learning environment for those students. We could certainly ask to have administrators, IT, look at this again. Have there been enough people with improved internet connectivity, those kind of things? But it would not be something that if we make them, you know, a decision tonight, that could be started tomorrow. That would not be realistic. It would not be feasible. So certainly it could be something to encourage our staff to do, but that's not actually part. That's not part of our policy right now. So like, there's not a policy that says we will not provide educational
Oh,
experience.
I
It's just that we
misunderstood
don't
then.
have a policy that allows that educational experience. And in order to create that new policy, we have to have the means to implement it. Does that make sense?
Yep.
Okay.
Just a question. I don't like, are we making motions when we wait? Are we waiting to get to action items or are we?
Yeah, we're not doing
No,
motions right
no,
now.
it's
This is just discussion.
testing the waters.
I just didn't even see it in an action item, so.
Okay. No, I'm just realizing that Angie is correct and it's not in our action items. The back to
Yeah,
school
pardon my
plan.
confusion. I just didn't see it there, so I wasn't sure where we were dealing with it.
Mhm. All right, everybody. I'm going to ask you to bear with us and have some patience. Are we actually doing a safety plan tonight? Okay. So we actually need to add the back to school plan to our action items in order to make any kind of motion or decision on this tonight. So I'm going to ask for an addendum to our agenda to add the back to school 2021 plan to our action items. So this can be voted on tonight. If anybody is willing to make that motion.
I move that we add our back to school 2021 plan to action items for tonight.
I will second the motion. Can I have a, all in favor?
Aye.
Aye. Opposed? Motion carries. So,
I think we need to.
okay,
Aye.
aye, okay,
Aye.
okay. So motion carries. So it'll be added on under action items. And just for those of you who need a little update on Robert's Rules of Order, that if two people vote and the other two do not vote, it's a 2 out of 2. That's why it carries. If two people abstain from voting, their vote is not counted. All right. So now that that work order has been finished, we're going to move on to the rest of our discussions, and then we'll go into action items. So the next discussion item is board district goals for the continuous improvement plan. I'm going to jump in and ask one question about this real quick. I did notice on our metrics, I should have written this down, but on the, I think it was ELA growth. No, that's the wrong one. Hang on one second. With an acceptable amount of growth. I better pull that up real quick.
ELA or IRI?
Oh, I think it was ELA. Do you have it up? It was that bottom right hand one that says, and
This-
yeah, that one right there. Can you
Okay.
read what that one is?
The percent of students who make adequate growth on the grade 4 ELA?
Mhm. That 25% seemed like an overly low number. So I was wondering the thought process behind that number. This is a new metric. We haven't had that metric before. So if we're looking at, I know we had a discussion about students are certainly going to show growth, either growing within their bracket of range of,
Mhm.
benchmark or strategic or, and then certainly wanting to see, even if students don't progress out of that range, to make sure that they show some growth. I guess I interpreted that this would be kind of the bare minimum of students who would show some growth no matter
Mhm.
what they're doing. And I just
Right.
thought that was kind of a low number.
Okay. Yeah.
Okay. All right, let's shoot higher,
Yeah.
right? Okay.
Mindy and I, yeah, we sat down and went through these.
That was
so
the only
maybe it's a
glaring thing I saw.
misinter- Yeah.
Minnie, do you have an approximate that you'd want to put in for tonight so that we could actually approve it?
So that'll be from the 3rd grade last year, going into our goal for next year.
We're at 42.
Is that what you had from before?
42.
Was that what you have as a 3rd grade from last year?
4th grade ELA.
We need a 3rd grade from last year
District-wide.
to see it's a new metric. So
Okay. District-wide 48.
I'm not, yeah. I know. So basically any growth is what they were saying. Mhm.
Third grade was 48%.
Okay.
That helps.
So third grade last year is 48. So we're going 5 over. So 52, 53, that somewhere in that area. We feel good with that.
And I suppose, actually looking up at the 6th grade ELA, ISAT. Oh, so, but see, the ISAT's different
Mhm.
than what I was just addressing. I was just, oh no, that is ISAT. Okay.
So my understanding is that we were looking at the data from the years past and coming up with a range that we felt comfortable with, and that it would be readjusted.
Yeah. And we look at
Also.
the class itself, not,
Right.
I mean, so third grade would be a 4th grade goal this year.
Right.
Third grade last year. So we're moving with them. Yeah.
Mhm. And keeping in mind, these are ISAT scores. And so that is a little different than like our IRI, which is within our own school, or MAPS testing in the junior high school, which is within our own school, showing growth from fall to winter to spring. This is just from year to year. So. Is that 6th grade ISAT growth of 34% appropriate as well? And it's okay if it is, because I know at that age, usually middle school age, they do start to drop off quite a bit.
You've got me questioning all of them.
Sorry.
That's okay.
I just saw that 25% and it just seems so
Yeah.
low compared to what we've talked about.
We would just have to go back and look it up
Mhm.
for that. So, but
Okay,
I feel comfortable with them.
okay. And we can always
Right.
approve it. And if we
Right.
need to make an addendum
Yep.
or append, we can always do
Right.
that later.
Yeah, I
Um,
thought it was a living document.
It is.
It is.
Okay.
Yep. Yep, absolutely. And this was based on a meeting that we had 2 weeks ago that we kind of went through
Mhm.
these individually. And keeping in mind that the numbers are reflective of a lot of variables. So. Okay. Any other questions about this document?
I don't have any.
Okay.
I look forward to continuing to learn how we utilize it as a tool.
Yeah. All right, we'll move on to our next discussion item, which is the board meeting action calendar.
So yeah, I took this from what we had a couple of years ago and we're trying to modify that. So I wanted to look this over. This is not really an actionable item at this point. I just wanted to bring it to everybody's attention and kind of get us on the same page. So as we go through this, if there's additional items, obviously we need to do this. This is kind of a guideline for everything. So
And that included the evaluation criteria and all that stuff that we
I think
did in the
I
contract
see.
believe, didn't
Yeah, this is, it was on here. Yep. So in October was the first one. Yes. Like I say, it's just kind of a general guideline. There's much more that, we have to do, but for you guys, this is a pretty good general outline.
I actually like the idea of keeping it in our board minutes, just from month
Okay.
to month, because then it's easy access. Anybody can see it and know what's going on for the agenda for the next meeting. If
So
that's
do you want to
agreeable.
add it as an item on here? Is that what you're saying? On the agenda?
Well, like, because I know you
Just as a,
tend to roll over the
Mhm.
minutes structure from meeting
Mhm.
to meeting and just leave it as a discussion item rolling forward, so that if we have things to add or
okay.
um,
Yeah.
edit or include,
Yep.
and or to discuss what's going to be coming up for the next meeting for preparation, those kind of things.
Okay.
Okay.
Yep.
Okay. Any further discussion? we're going to move on to our action items. Now we didn't actually type it in yet, so I'm just going to add it as number 1 since it correlates with our discussion item number 1 for the back to school plan 2021.
Okay, I'll make a motion that we institute masking in all JSD 171 facilities and transportation until we are cleared to go to masking recommended by the chief medical officer of Clearwater Valley Hospital and St. Mary's Hospitals.
Can we add the time frame be evaluated monthly?
Oh, yeah, sorry, of course.
And I think it would be better to have it actually data driven by rates in schools. And be really tied to the rates
Hold
within
it.
our
I'm
institution.
going to have to stop you for just a second because we're in the middle of a motion. So we
Yeah.
have to finish this motion and then we discuss.
Okay.
And we can add more motions on top of it if we need to, but I've got to follow the rules. So hang on, we'll get there. I promise. So I'm going to second the first motion so that we can go into discussion. Chris, keep going.
Okay. All right. So can we modify the motion?
Yep, now you can modify.
So Angie, would you modify your motion for a monthly review?
Yes, absolutely.
And
Okay.
would you also modify your motion based on data within the institution?
I'd like to have Dr. McGrath interpret the data in our community and our institution to make that recommendation. In the past, we've gone with the public health recommendation, but that's kind of a broader one because it's the whole public health region. So I just thought with Dr. McGrath, he's really got, he can pull data from what's really happening in our community. And then he's made himself so available to us. I think that, and he has, honestly, he has like the testing rates. Well, he's got that 3 times a week, and that's a lot more frequent than what our public health can do as far as the frequency of data updates, just because of their tracking capabilities and their lack of staffing. They really are behind us on that. So any data that we have is going to come from those 2 sources. And actually, he has more up-to-date data more frequently than what we get from public health.
I'm going to propose that maybe we meet somewhere in the middle and have it based on data from like Clearwater Valley Health as opposed to one person or to provide the data to the board meeting so that we can use that data for the decision. But as opposed to having it rely on one person for a recommendation or for, because what if you can't make it to a meeting or something like that? That would be the concern.
Okay.
But isn't public health the entity that's ultimately responsible for that data?
They're not up to date with the data, unfortunately, because they're so overwhelmed with the region. They're not just Clearwater Valley or Clearwater County. So we wouldn't get the same day-to-day data that we would get from the
I
local
agree with that.
hospital.
Our data we get from public health can be delayed 2 to 5 days, depending on what's going on. So
I don't want to be exclusionary of the entity that's responsible for public health in the state of Idaho, though. And you're excluding them and that data source. So let's not exclude them. What about relevant data sources?
Well, I think that we could say the Clearwater Valley Health System data and public health. I think that would be more pinpoint than just saying relevant, because that's subjective. I think we should name what our data sources are going to be that we consider.
Well, I think that it should then include the CDC. It should include the building administrators, because I would like to know monthly what the situation is from their perspective in their buildings
Do you want their opinion or do you want data?
data.
Yeah,
And
so
opinion.
let's look at district district rates, the hospital data, CDC recommendations, and our public health rating. Would that work?
I'll wait for a reading of the revised motion.
Hmm.
Okay, then. Hey,
I'm
Jessica,
going to
you still
propose
there?
this simple, relevant data.
Thank you. I like that. I like relevant.
I just think that that's subjective. I'm just saying, if I can make the motion.
Okay.
I move that with our monthly, we go to mandatory masking to be reviewed at our monthly scheduled board meetings. And the mask mandate will be based upon, and the review will be based upon local hospital data pertaining to COVID, our public health district data, CDC recommendations, and infection and quarantine and closure rates at our schools as per building administrators.
Um, So the motion on the table is to have mandated masking at Joint School District 171 to be reevaluated at monthly board meetings and to be evaluated based on district rates, hospital data, public health data, and CDC guidelines. Does that meet all that you said?
I think so.
So any further discussion or motions?
Okay, can you repeat the last part of that?
I sure can.
I'm just trying to map this
Yep.
out in my mind.
Required, they're trying to make it hard on me. Required masking at all Joint School District 171 facilities based on, to be reevaluated at monthly school board meetings based on data from local hospital sources, public health data, CDC, and current district rates.
Okay.
Right.
CDH district. and CDC. So public health, district data, Clearwater Valley Hospital, and CDC.
Okay, all in favor?
I
I seconded it earlier. So, all in favor? Aye. Opposed?
Nay.
Nay.
Motion does not carry. Is there another motion to be made?
There's got to be a way we can come up with something that makes sense, that isn't.
Is there any further motions to be made?
Well,
I'll move.
Do you-
as a science-based person, I can't not move. I mean, you move too quickly for me.
I know.
So,
So, and that's what I was
um,
going to ask. I can give you a certain amount of time, but I also don't want it to appear like I'm waiting for something that's on my own agenda. Does that
well,
make sense?
You're waiting
So,
for me.
it's-
So I agree with the data that's presented, the information that we have in front of us, that it's worth a try. So I would vote aye.
So that motion's already been,
Okay, so we'll
Denied.
start over.
so we have to start over. Is there a motion to be made?
So I'll move that we mask in District 171 until the October board meeting and reevaluate based on the data that's available to us in the district, through public health, through our local hospital and CDC.
I will second the motion. So the motion on the table is to have required masking in joint school district 171 until the October scheduled board meeting to be reevaluated based on data provided from the district, the local hospital, public health, and CDC. Any further motions or discussion? All in favor?
Aye.
Aye.
Yes, ma'am, I.
Opposed?
Nay.
Motion carries. Moving on to action item 2, safety plan. I'm sorry, ma'am, but no discussion. So, hey, guys. Hey, Chris and Chris, I need you to step out. That's actually required. If anybody's speaking from the public and they're not listening to the request to stop speaking, I have to have you exit the room.
They're leaving.
Okay. Okay, moving on to action item 2, safety plan. Dr. Garrett. I know.
Actually, I'm just making sure.
Okay. We it'd be
As soon as possible.
it'd be effective immediately as best possible. So last year when we did this, you guys had masks at the doors, paper masks that you handed out. That every student walking in, if they didn't already have a mask, then they got handed a paper mask as they entered the facility.
Mhm. Yeah.
So we're going to just take a pause on our board meeting. We'll resume as when Dr.
So you make an announcement tomorrow, right? And hope that everybody comes the next day. Right? I mean, that's the best that we can do. Because not everyone is participating in this, and it's not their fault one way or another whether they are. So we tell them tomorrow morning, right?
I just like the school closures, there can be a skyward email to be sent out tonight. We get updates and then they all. Thank you, Russell. So they're with Skyward, just as if there was an emergency school closure tomorrow or snow day, they can all be notified before school starts tomorrow morning. Every parent can have this information tonight or first thing tomorrow morning before school resumes. But I'm gonna table no more discussion. It just violates the board meeting.
Yep, sorry about that.
So we're gonna keep moving. Action item 2 is safety plans. Try and get back on track.
Yeah, so I sent you guys the safety plans from, we had met with law enforcement, OPD, and the Clearwater County Sheriff's Department. And we had reviewed, I met with Chris St. Germain was in on that committee meeting as well. So we discussed, I sent you an invitation on it as well, but you said you couldn't make it, I believe. Yes. Yeah. So, so when we sent you those plans, basically they have our contact information, where our kids will exit to, those type of things. And that's why it's confidential. It's not something we can get out in the public. Law enforcement knows, first responders know, and then of course our administrators know as well. So those plans we do every year annually, and we want to make sure they're updated. So one of the additions that was brought up was the buildings at Timberline. So we do have those updated. There's different location with the outbuildings that we currently have versus where they were. We have our temporary buildings out there. So those are all updated as well on the map portion of it. So just an annual review. There's another piece to the safety piece that I'll be bringing up to you guys. I have a more extensive, more organized type safety plan that I want to bring up to my administrators as well. And I'll be bringing that to you. We'll work on that throughout the year, and it'll probably be next year before we really get through all of it. But there's a piece of it that just makes a lot more sense than just kind of what we were throwing together. So it'll be much more detailed, and with what's going on our day and age, we kind of need that. So look for that coming in the future.
Can I have a motion to accept the current safety plans?
I'll move we accept the current safety plan.
I'll second.
It's been moved and seconded to accept the current safety plans. Any further discussion? All in favor?
Aye.
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 Aye. Opposed? Motion carries. Action item 3 is continuous improvement plan.
Yeah, and that was just what you guys had seen with the changes we've made. So we're comfortable with where that stands.
And it's a evolving document. Mhm.
I'll move we accept the continuous improvement plan for the 2021-22 school year.
I'll second.
It's been moved, seconded, and seconded. All in favor?
Aye.
Aye.
Aye. Opposed? Motion carries. Alternative authorizations.
Yeah, so alternative authorizations, these three, one of them is a renewal basically of a regular certification. The other two are getting certified above and beyond where their regular certification is. So they're getting endorsements pretty much outside of their area or extending within their area. So those are considered alternative authorizations, but we have to approve them. We go through the application process and either through a mentoring program or some sort of educational program to get that endorsement. So, and we did some last month, I believe, as well. So I believe we have, I think, 6 total that we're doing, just as we have the need come up as we build our schedule. Sometimes we have to adapt.
And I think at the end of the school year last year, we had no
Correct.
alternative authorizations. So these are new based on new
Yes.
hires and new subjects
Yes.
taught. correct?
So I could go through some examples if you really would like me to, but basically, if you look at these, there are people that are teaching within their area and some outside of their area. So for example, like at Timberline, the flexibility we have to have with our teachers teaching multiple subjects. We have a teacher up there who's teaching, PE, and we'll be teaching middle school social studies, certified in PE and health, but going to be doing middle school social studies. So we're getting her certified in that. So she's going through that process of the mentoring program and the schooling and the praxis to get that. So it's a great way to get more endorsements. If the teachers are willing to do that, it gives us a lot more variety of teaching and education. So
Can I have a motion for an alternative authorizations as listed?
I move that we accept the alternative authorizations as listed.
I'll second.
Been moved and seconded to accept the alternative authorizations as listed. Any further discussion? All in favor?
Aye.
Aye.
Aye. Opposed? Motion carries. Emergency closures.
yeah, so the reason we did this was we were not able to offer the online at that point, and I talked to you guys a little bit about that. So for us to declare emergency closures on those dates, we are not docked on our ADA. So that helps us financially. We also have some hours and days built into our schedule when we build our calendar. So we can utilize those days, such as a snow day and we have to apply to the state for those. And the board has to approve those once we send that application in, and then we can basically, I don't want to say be forgiven, but we have the opportunity to make them up. We either have the hours to make them up or we'll have to have extra days. In this case, we have the hours to make them up.
So just to clarify, for these schools that will go against their snow days.
Yes, the built-in extra hours that we have. Yes, that is correct.
Well, I move that we accept the emergency closures as listed.
I'll second.
It's been moved and seconded to accept the emergency closures as listed. All in favor?
Aye.
Aye. Opposed? Motion carries. New hires and separations, I did not see any listed.
I did not see the list either.
Do we have none?
That's a really good question. I'm sure we do. Let me get my list. Jessica, you're on there, right?
Yes,
Did you share that with me?
yes.
Did you tell me you did? Did you send me an email? Come on,
Yeah.
I'm trying.
Probably not. You want me to reshare it with you, Dr. Garrett?
I can probably find it. Give me a second.
Okay.
Timber new hires. Okay. I think I have it. Let me pull it up and you guys can review this as well. I apologize for that. Share my screen.
Oh.
Are they all on there?
Yes, that looks right.
Okay. So this is what happens when you focus on COVID nonstop during the day. I miss putting the link on. And those should have been made public. Yeah.
I'll make a motion that we approve new hires and separations as reported.
I'll second the motion. It's been moved and seconded to accept new hires and separations as listed. All in favor?
Aye.
Aye.
Aye. Opposed? Motion carries. Do we have anything for executive session tonight?
I have none.
Then any board member input for future agenda items?
I don't know. This just makes me excited to actually talk about the continuous improvement plan someday. As an alternative.
I'm just going to scroll back up to our calendar. Yep, to see what we're discussing next time. That's why it's nice having it there.
Let's see.
So for November, no, October, sorry, I'm going too fast. So
Yeah, so we have the auditor
Audit.
coming. Yeah,
mhm,
the auditor is coming on Thursday, I believe, the 20, let me get back here. Yeah, the 23rd this week, our auditor will be in to do the work in-house. Brittany's been putting all that together, so that audit, I don't know as it'll be completed by then, but we'll have a good idea. So we did. Yeah. So we have to have it approved by December is when we really have to approve it, but hopefully we'll have something for you guys to review. And then he generally comes in the December meeting, I believe it is, to give the report to us to approve it.
and then, and we'll have an executive meeting regarding setting superintendent goals based on the continuous improvement plan and whatever else that we think of at that time.
Sounds like fun.
Okay.
Mhm.
All
Yeah,
right.
I'll have documents to share with you guys as well, based on some of the goals that I have currently have that I can update, and then we can set more if we need to.
Okay. If there's nothing further, I will adjourn the meeting. Thank you, everybody, for coming tonight.
Thank you.